Rexulti is an antipsychotic agent with a novel mechanism of action as a serotonin dopamine activity modulator, SDAM. Rexulti has a high affinity for the dopamine D2 receptor and modulates signal transduction hyperactivity to an appropriate level through its partial agonism. Through this mechanism, it is likely to exert antipsychotic effects without prolactin elevation and extrapyramidal symptoms due to excessive blockade of dopamine D2 receptors. Binding of a full dopamine agonist at the dopamine D2 receptor induces full signal transduction, while binding of a full dopamine antagonist at the dopamine D2 receptor completely blocks the dopaminergic neurotransmission. Aripiprazole is a dopamine partial agonist that binds to the dopamine D2 receptor and allows partial stimulation of the dopamine D2 receptor while blocking the endogenous dopamine from binding to the dopamine D2 receptor. Aripiprazole and Rexulti are both partial agonists at the D2 receptor. Rexulti has a lower intrinsic activity at the D2 receptors than aripiprazole and has a lower potential to induce D2 partial mediated adverse effects including nausea, vomiting, excitement, and agitation. In addition, Rexulti exhibits high affinity for serotonin receptors and its partial agonistic effect at serotonin 1A receptors in the prefrontal cortex, and is expected to improve negative symptoms, cognitive impairment, depression, and anxiety. Rexulti is an antagonist at the serotonin 2A receptors, which facilitates dopamine release in the striatum and the prefrontal cortex, possibly leading to less extrapyramidal symptoms and improvements in negative symptoms and cognitive impairment. Rexulti has a similar affinity for both dopamine and serotonin receptors, which is one of its unique characteristics. Rexulti has shown to have more than 50 times lower affinity for histamine H1 receptors compared with the dopamine D2 receptor. High affinity at the H1 receptor is associated with weight gain and sedation. Rexulti also has lower affinity for muscarinic M1 receptors, resulting in reduced anticholinergic adverse effects and cognitive impairment. Rexulti, a drug in the class of SDAM, has modulatory activity at the serotonin and dopamine systems that strongly combines partial agonistic activity at serotonin 1A receptor and at dopamine D2 receptors with antagonistic activity at serotonin 2A receptors. Rexulti exhibits both dopamine partial agonism and serotonin dopamine antagonism, meaning that it protects against excessive blockade of D2 receptors while showing a high affinity for serotonin receptors at the same time. A novel mechanism of action as a serotonin dopamine activity modulator, SDAM. It can provide a great opportunity and possibility for the treatment of schizophrenia. Make way for possibilities.
For over 50 years, the monoaminergic system has been the prime focus of research and treatment in MDD. However, traditional oral antidepressants that target this system still leave 30% of patients unresponsive to treatment. As an antagonist of the NMDA glutamate receptor, Spravato is the first licensed antidepressant in 30 years to target a new pathway in major depressive disorder for patients who have not responded to 2 antidepressant treatments. Glutamate is believed to have an important role in facilitating synaptic plasticity in brain regions implicated in depression. The therapeutic mechanism of action of Spravato is not fully established. Evidence suggests that through NMDA receptor blockade, Spravato produces a surge in glutamate release. This increases AMPA receptor stimulation, activating downstream neurotrophic signaling, which may help restore synaptic plasticity to brain regions affected by MDD. In clinical trials, Spravato, in combination with an oral antidepressant, has demonstrated, onset of efficacy as early as 24 hours, superior reduction in depressive symptoms at day 28, reduced risk of relapse, the ability to sustain response over the course of 1 year, and a favorable tolerability-efficacy profile. Spravato, a breakthrough therapy and a new hope for patients with treatment-resistant depression.
This video will show you 3 important steps for correctly administering Invega Sustenna. For a full list of instructions, refer to the datasheet. To prepare the injection, first shake the syringe vigorously for at least 10 seconds to ensure a homogeneous suspension. The recommended needle size is based on the patient's weight and site of injection. The 22-gauge needle is used for all gluteal injections and for deltoid injections in all patients weighing 90 kilograms or more. For deltoid injections in patients weighing less than 90 kilograms, use the 23-gauge needle. Remove the rubber tip and attach the needle to the luer connection by rotating clockwise. It is important to pull the sheath away with a straight pull. Do not twist. Remove any air by moving the plunger forward carefully. Hold the skin taut and inject deep into the deltoid muscle at a 90-degree angle. Inject the entire content slowly into the muscle. Do not administer Invega Sustenna subcutaneously or intravascularly. After the injection, activate the needle protection system until a click is heard and discard appropriately.
Lundbeck sebagai perusahaan farmasi global dengan pengalaman lebih dari 70 tahun di bidang neuroscience berkomitmen untuk terus mengembangkan dan menyediakan pengobatan terbaik yang dibutuhkan oleh orang-orang yang menderita brain disease, termasuk juga pengobatan pada depresi. Brintellix merupakan antidepresan terbaru dengan mekanisme kerja multimodal yang memperbaiki mood dengan additional benefit, perbaikan fungsi kognitif, dan profil keamanan yang baik. Seperti dokter ketahui, depresi merupakan manifestasi dari kombinasi 3 domain gejala, yaitu mood, fisik, dan kognitif. Dalam studi meta-analisis 11 studi jangka pendek disebutkan bahwa Brintellix efektif dalam menurunkan keseluruhan gejala depresi yang diukur pada 10 item MADRS. Selain itu, Brintellix menunjukkan efek yang signifikan pada perbaikan fungsi kognitif dibandingkan antidepresan lain. Serta, Brintellix memiliki efek samping yang lebih minimal sehingga dapat ditoleransi dengan baik oleh pasien. Studi meta-analisis 21 antidepresan terbaru dari Cipriani tahun 2018 menunjukkan bahwa Brintellix menempati posisi tertinggi pada efikasi dan akseptabilitas pada perbandingan head-to-head study. Brintellix diindikasikan untuk gangguan depresi mayor pada usia dewasa yang dapat mengembalikan fungsi aktivitas sehari-hari pada orang dengan depresi, yaitu dalam melakukan pekerjaan, aktivitas sosial, dan kehidupan berkeluarga. Brintellix membantu orang dengan depresi untuk feel, think, and do better. Informasi lebih lanjut tentang Brintellix dapat menghubungi perwakilan Lundbeck.
Frixitas XR. 1 kali sehari, less sedative, excellent for your productivity day. Frixitas XR mengandung zat aktif alprazolam extended release 1 mg. Merupakan golongan benzodiazepin yang paling banyak diresepkan untuk gangguan ansietas. Frixitas XR menunjukkan kesetaraan dibandingkan dengan produk originator. Berikut adalah dosis fleksibel alprazolam XR dibandingkan dengan placebo berdasarkan frekuensi serangan panik per minggu. Sementara, berikut adalah dosis fleksibel alprazolam XR dibandingkan dengan placebo diukur dengan tingkat perbaikan pada serangan panik. Zipren ODT, creating a comfortable mood with a good tolerance. Zipren ODT mengandung zat aktif aripiprazol 10 mg dan 15 mg. Zipren direkomendasikan untuk manik, pencegahan kekambuhan pada gangguan bipolar, skizofrenia, dan depresi berat. Zipren mempunyai efek kenaikan berat badan paling rendah, bahkan tidak menyebabkan kenaikan berat badan dibanding dengan antipsikotik lain. Memiliki efek samping minimal dibandingkan dengan antipsikotik lain dan menurunkan kadar prolaktin lebih baik dibandingkan standard of care pada pasien skizofrenia. Zipren menunjukkan kesetaraan dibandingkan dengan produk originator.